put on it. My concern is, does it increase quality access for more people? And unfortunately, Obamacare does neither. It is a boon to the insurance industry because it guarantees, by the individual mandate, it guarantees 30 million new customers by fiat, by threat of fine and possibly jail time, and that's absurd. Dick Durbin, Paul Krugman, the report released 2 weeks ago by Health and Human Services, and many others admit now that insurance premiums will most definitely rise under this plan, and which is funny because the Bureau of Labor Statistics put out a report that showed that health insurance premiums fell by 3.2% in 2009. So we may have been on our way down in the cost, but now we're going to go back up. Rationing. Obama's director of the Office of Management and Budget, Peter Orszag, admitted last week that there will be necessarily rationing, which was the entire purpose of creating the Independent Payment and Advisory Board and the Comparative Effectiveness Research Committee. So they can go through and decide who gets what treatment and how much it should cost and everything. Taxes, innovation, medical equipment, it'll make more expensive for people who can't afford it. Costs always get passed down to the consumer. Companies don't just take it, they pass it on to the consumer. Massive doctor shortages, we already have one. If people decide not to get into the medical profession and we squeeze doctors out, what's going to happen to patients when there's not enough doctors? Vouchers. So things I think should happen. Vouchers. So for the people who are desperately in need, and I'm not talking about people who can work. Okay, my dad is a trained lawyer. He lost his job a long time ago, and he worked at 4 a.m. at the Nintendo factory on the assembly line because he had to support my family. Okay, people can work sometimes, and I'm talking about the people who desperately cannot work. My husband's brother works with people. He worked in a group home. He worked with a man who was deaf, blind, and mentally retarded. Okay, he has no family. He had no one to take care of him. I can understand wanting to help someone like this who needs help. Okay, vouchers though, so people can spend their healthcare dollars the way they want to, competitively, the way we compete the way businesses have to compete for all of our other business, not just healthcare. Divorce health insurance from employers, which started, FYI, under FDR during his wage and price controls. Corporations and businesses wanted to attract new talent, but they couldn't raise their wages to attract them, so they decided to tack on other benefits such as health insurance, and that's when it started.